Hello, everyone. Welcome to my page, and you're welcome to Blissful Life. My name is Priska. This evening, we are going to talk about gestational diabetes. Gestational diabetes simply means having a high blood sugar during pregnancy, which tends to disappear after you must have given birth. This condition can develop at any point during the pregnancy, but it is mostly frequent, or it mostly occurs during the second and the third trimester, that is between the 24th and the 28th week of pregnancy. And what causes this? Gestational diabetes is caused as a result of the body producing little insulin to help control your blood sugar. And what is insulin? Insulin is just a hormone that helps to keep your blood sugar in check. Insulin helps to lower or control your blood sugar. Now, every woman who is at a childbearing age or who is pregnant is probably prone to having gestational diabetes, but there are people who have a higher risk of having this disease condition than others. First of all, is people from Asian or African ethnicity. They tend to have a higher risk of developing this condition. If you've got high blood pressure during pregnancy, if you developed high blood pressure during pregnancy, there's a possibility that you're at a higher risk. If you are obese or overweight, you are prone to having gestational diabetes. If you've had a previous pregnancy before, and in the previous pregnancy you were diagnosed of having this condition, there is a possibility that during your subsequent pregnancies it might still reoccur. Also, if there is if you have a history of diabetes in your bloodline, if it's hereditary in your family, then you could be also at a higher risk of developing gestational diabetes. Okay, now let's go to the symptoms. So most times if you've got gestational diabetes, there may not be symptoms. All right, it's just you only know when you go to the hospital for your routine check, and then they pick it up from there. But then there are people who, when their blood sugar goes extremely high, they tend to have symptoms like dry mouth, excessive thirst. You want to drink all the water in the whole world. And then when you drink water, what else? You pee a lot. And then there is blur vision. There is fatigue. And then there is yeast infection. Yeah, your genital will be itchy. All right. But during pregnancy, some of these symptoms I've just mentioned here up, if you notice them. So, but at some point or at any point you feel bothered that these symptoms are way too much, or they're taking too long to resolve themselves, kindly talk to your midwife or to your doctor, and they would look into this. Okay. Now, gestational diabetes tends to pose a lot of problem to the mother and the child. For the child, you tend to have larger babies, larger than normal type of babies, and sometimes you may have to do a cesarean section or an induction to bring out the baby. Okay. Sometimes, in extreme or rare cases, you may have a stillbirth, a situation where the baby dies in the uterus. You can also when the baby is born, there's a high tendency that this child will have jaundice. Yes, the child may have jaundice also. So what else? Sometimes this child tends to have low blood sugar. Yes. If you give birth having gestational diabetes, the baby can have low blood sugar. So when you give birth in that condition, your baby would need to be taken extremely care of, all right, within the first few weeks, just to be sure that this child is stable before they discharge you. Now, how to control or treat gestational diabetes? I won't say there's a treatment to this because it can happen to anyone. I mean, it is nobody's fault that it is occurring, but there are things you could help, to do for yourself to help keep this condition under control, which includes you have to once a diagnosis has been made, once you've been told that you have gestational diabetes, so you have to try and help yourself. How are you going to do this? By changing your dietary requirements. You see, your diet, you have to change it. You see, when you wake up in the morning, you say the baby wants to eat fufu. You will stop it though. Not like you're gonna stop it, but you're going to extremely cut down on it, because carbohydrate, as we all know, also help to increase the sugar levels. So for the dietary management of gestational diabetes, you need to eat lots and lots of fruits. You have to nibble on your fruits. You have to eat your fruits. You need to eat avocado. You see, avocado, pear, you will try avocado, pear. You see, fish, you try to eat fish. You cut down on fruit juice. You see, fruit juice, orange juice, you have to cut down on it, because obviously we know that it contains lots and lots of sugar. You see, yam, all this sweet potato, you have to run away from them a little bit. You see, exercise, even if you can't run, because it's not even advised for you to run anyway, but if you can run, you run. But if not, you can, walk to a distance to and fro, just to help you keep fit and also help the body to burn down the excess sugar you've got. And then medically treating, you would have to be put under an insulin. Yeah, some medication will be given to you. The doctor would have to give you some insulin injection or some tablets that would help to modify or that would help to control your sugar levels. And if you abide by the rules, if you eat healthy, if you take your medication, if you just abide by the rules, you will see you will have a very, very healthy baby. You'll be healthy and your child will be healthy. But then there are some people, even after doing all these things, their sugar level will still not be controlled. But once the baby is born, the sugar level tends to go down. Okay. So if you're in a category where your sugar level does not want to go down, and then you've given birth to the child, but the sugar level is still high, I believe the doctors would take it from there. They would make sure that they give you insulin. They will tell you about your dietary regime. You would have to be checking your blood sugar from time to time so that they could monitor it and know what to do for you. This condition is not a do or die affair. It's not like if they tell you that you've got gestational diabetes, you'll be like, hey, my whole world is finished. That's not true. It's not true. It doesn't work that way. Okay. And then again, if you have gestational diabetes and then they tell you that your child will be born through cesarean section, don't go and start saying that you is a lie. It's not the type of confidence you have with God. God said you are going to give birth like a Hebrew woman. Please abide by the rules. What we want is the end product. And what is the end product? That you're healthy and your child is healthy. Okay? So I believe at this point, at least, we now have an idea of what gestational diabetes is and the causes, the symptoms, and every other thing that goes with it. Thank you so much for your audience. Thank you so much for listening to me. If you're happy with this video, kindly click on the like button, all right, and share this video as well. Thank you so much, and I'll see you in my next video. Bye.